Okay, we continue with tongue diagnosis made easy sa cracked tongues part 2. Okay, we have here another case of a male, 22 years old. Ang tongue po niya is reddish, big, slightly thin. So this indicates that there is an onset of kidney deficiency. Next, meron siyang horizontal cracks, rough, yung tongue surface. So kung titingnan po maigi, meron siyang horizontal cracks. This indicates that there is an onset of stomach yin deficiency. Meron din siyang deep vertical crack in the anterior third. So dito po sa may front ng tip ng tongue. This indicates that there is a lung yin deficiency. Ang patient, meron siyang symptoms of chronic nasal congestion. Meron siyang pain and pressure in the nasal sinuses. Feeling of tightness in the chest and asthmatic attacks. Tendency to catch colds. Ang Western diagnosis niya, meron siyang allergic rhinitis, allergic asthma, and sa background to disease, meron siyang family history of allergic rhinitis and asthma. Meron siyang poor diet during puberty and emotional problems due to divorce of parents. Okay. Next patient, we have a female, 49 years old. Ang tongue po niya, kung titingnan maigi, is pale. Meron siyang, this indicates that there is a blood deficiency. Meron din siyang red in the anterior third. This indicates that there is heat in the upper burner. Meron siyang vertical crack with horizontal cracks branching out. So dito, meron siyang vertical cracks kung titingnan maigi. This indicates that there is an onset of stomach and kidney yin deficiency. Meron ding dry, reddish center, which indicates that there is lack of fluid in the stomach. Meron siyang turns distributed over the entire tongue body. So this indicates that there is an internal heat. The patient has symptoms of exhaustion. Meron siyang thirst, severe palpitation, meron siyang headache at the vertex, and night sweats. Sa Western diagnosis, meron siyang iron deficiency anemia, and sa background to disease, caffeine and nicotine abuse. Next patient, we have a female, 28 years old. Ang tongue po niya is reddish and dry, which indicates that there is lack of fluids. Meron siyang deep horizontal cracks, indicating that there is a stomach and kidney yin deficiency. Meron siyang dry coating without root. So this indicates that there is a kidney yin deficiency. The patient has symptoms of night sweats, may insomnia, shortness of breath, inner tension, meron siyang exhaustion. There is none sa Western diagnosis, and sa background to disease, difficulty, pregnancy, and birth. Next patient, we have a female, 35 years old. Ang tongue po niya is slightly pale with firm tongue body. This indicates that there is a slight deficiency of blood and fluid. Ang tongue din niya is dry because this indicates that there is lack of fluids. Meron siyang horizontal and vertical cracks, which indicates that there is an onset of stomach and kidney yin deficiency. Ang symptoms ng patient, there is dry cough, dry throat, difficulty with inspiration, difficulty in breathing during the night. Sa Western diagnosis, meron siyang allergic rhinitis, allergic asthma. Sa background to disease, family history of allergic rhinitis and asthma. Okay. Next patient, we have a female, 42 years old. Ang tongue po niya is reddish, which indicates that there is a slight kidney yin deficiency. Meron siyang cracks distributed over the entire tongue body. which indicates that there is a stomach and kidney deficiency. Sa center of the tongue, may red and without coating, indicating that there is a stomach deficiency. Meron siyang thin yellow, one-sided coating. Okay? Indicates that there is a slight retention of damp heat in the liver and gallbladder. Ang patient, ang symptoms niya, burning sensation of the tongue. Meron siyang night sweats, palpitation, insomnia, frequent smelly loose stools. Meron siyang pain under the right hypochondrium and inner restlessness. There's none sa Western diagnosis. And sa background to disease, overwork, caffeine abuse, pregnancy at a late age. Okay. Next patient is a male, 48 years old. Ang tongue po niya is slightly red, firm tongue body, indicating that there is a kidney deficiency. Next, meron siyang slightly bluish. So this indicates that there is a blood stasis. Meron siyang horizontal cracks over the entire tongue body, indicating that there is a kidney deficiency. Meron siyang yellow, dry coating, accumulation of damp heat in the liver and gallbladder. So the symptoms, pain in the ankle upon exertion, smelly diarrhea, meron siyang chronic sinusitis and itchy scalp. Sa Western diagnosis, meron siyang SADC syndrome. And sa background to disease, meron siyang alcohol and salt abuse, trauma, fracture of the tibia with ensuing osteoporosis. So sa case history, this 48-year-old builder suffered an accident at work that resulted in a complicated fracture of the tibia. After a corrective operation, the patient underwent 18 months of physical therapy. Nevertheless, osteoporotic changes developed around the site of the fracture. The affected leg was painful, especially with any movement or physical strain. This did not improve despite extended physical therapy. So kahit na physical therapy, hindi masyado nag-improve. The patient seemed very restless. His scalp felt itchy and hot. He had several bowel movements during the day. His stools were soft, occasionally watery, and were accompanied by a strong smell. He also suffered from chronic sinusitis, which led to nasal congestion. The tongue was slightly red and bluish, dry, and cracked. His pulse was floating, excessive, and wiry. Sa analysis, the reddish, cracked tongue showed a deficiency of kidneyin. The overuse of salt over a period of many years, chronic diarrhea, and the presence of heat from deficiency all contributed to a lack of fluid and yin. Because essence is closely associated with kidneyin, a long-standing deficiency of kidneyin will always affect the essence. It is the essence that is responsible for the health and nourishment of the bones. Here, it was because of the underlying deficiency of yin and essence that the healing process of the fracture was retarded and complicated. So dahil po sa yin and essence deficiency, yung health and nourishment ng bones, so dahil po sa fracture, na-retard and incomplete. So mas matagal po ang recovery. The patient drank large quantities of wine and liquor daily. The yellow, dry tongue coating reflects the presence of damp heat in the liver and gallbladder, possibly caused by the consumption of alcohol. The liver channels traverses the cheeks and sinuses. When the heat from excess enters the channel, it becomes constrained and cannot drain out. This can lead to a clumping of fluid that transforms into phlegm heat. This in turn interferes with the downward moving action of lung qi, the impairment of which here resulted in a sinusitis and nasal congestion. So, yan po yung reason why nagkaroon siya ng meron siyang sinusitis and nasal congestion. So, damp heat in the lower burner is responsible for the loose, smelly stool. The hot, itchy scalp may be an indication of heat rising to the head. The internal heat is a dominant factor in the pathology of this patient. It injured the fluids, resulting in a dry tongue coating as well as a firm tongue body. In turn, this heat continued to injure the kidney, preventing the healing of the bone. Even after 6 months of treatment with Chinese herbs that focused on this pathology, this osteoporosis did not improve. However, the patient had become free of pain and the mobility of his ankle had greatly improved. So, nagamit po ng mga Chinese herbs. Okay? In general, cracks indicate gene deficiency. So, pag meron tayong cracks, masasabi kaagad natin na meron siyang presence or it could indicate a kidney deficiency. There are many different types of cracks according to their location on the tongue. Pwedeng heart crack, single stomach crack, scattered stomach cracks, spleen cracks, central lung cracks, pwedeng bilateral lung cracks, stomach lung cracks, Ice-floe cracks, kidney cracks. The location of the cracks, therefore, allows us to identify which organ is affected by the yin deficiency very clearly. So, kung saan po located yung cracks, yun po makapagsabi sa atin kung alin po yung may yin deficiency. Please note that not all cracks always indicate yin deficiency. So, hindi naman lahat daw na may crack ay nag-indicate ng yin deficiency. For example, a shallow heart crack indicates a constitutional tendency to mental emotional stress. So kung, for example, dito yung shallow cracks, hindi naman kaagad makapagsabi ito na yin deficiency, but we could say that mayroon siyang tendency to mental emotional stress. Bilateral lung cracks indicates past disease of the lung, usually dating back to childhood. So whenever makakita po tayo ng bilateral, lalo na diagonal lung cracks sa area ng lung, this could be a past disease like during their childhood. Cracks can become shallower with treatment. So habang tinitreat natin kung ito po ay cracks na due to health condition ng patient, and during treatment, ma-observe po natin na kung effective yung treatment, na shallow po yung cracks ng patient. In general, cracks indicate yin deficiency. So, yun po yung yin deficiency. So, here we have a picture of a heart cracks. Next, stomach crack naman. Dito, sa stomach area. Ito rin na third picture, and fourth, mga stomach cracks. And itong next is a stomach and heart crack. Combination po siya. In general, cracks indicate yin deficiency. So here, yung lung crack indicating dito po sa may area ng lungs. Lung area ng tongue, okay? And yung sa middle picture, meron siyang 2 diagonal cracks kung i-observe po natin mabuti. And yung third picture is a lung and stomach crack. So, yung area ng stomach and lung, meron po siyang crack. Okay, dito meron siyang spleen cracks naman. We could observe dito po sa may, lalo na sa may sides. Ito namang next is an old age cracks. Marami po siyang cracks na parang dry. And itong kidney cracks naman hanggang dun po sa may likod. Okay? Sa heart crack, the heart crack is a long midline crack that starts near the root of the tongue and extends all the way to the edge of the tip. Occasionally, it may extend to the very tip of the tongue. So, hanggang sa tip po ng tongue, itong heart crack. The clinical significance of the heart cracks depends on its depth and on the color of the tongue. If the heart crack is relatively shallow and the tongue body color is normal, this indicates not an actual heart pattern, but simply the constitutional tendency to mental emotional stress. So, hindi po yung actual heart pattern, but constitutional tendency to mental emotional stress. In other words, when subject to the same stress, a person with shallow heart crack will suffer more emotional problems than one without. So, pag na-observe po natin ito sa isang kakilala natin na meron siyang heart crack and mababaw lang po without any symptoms, meron siyang a constitutional tendency to mental emotional stress. So, dapat hindi po siya na-stress out because this patient could easily be affected compared to those that without heart crack naman. So dito, another example of heart cracks. Okay? Ito pong tatlo, puro po ito mga heart cracks. Okay? So here, another picture, meron heart cracks. Okay, observe po natin mabuti. While dito naman sa baba is a stomach crack. Yung stomach crack na dito sa may stomach area, ganun din itong mga picture. And itong last picture is a stomach and lung crack. Okay? So, another picture is a stomach and lung crack. Itong first picture, meron siyang bilateral cracks on both sides. Pero yung isa hanggang dun sa may stomach area. Stomach and lung crack na sa may lung area hanggang dun po sa stomach area yung cracks. And next, stomach and intestinal crack hanggang dun po sa may likod. Okay? Stomach crack is a midline crack that is in the center of the tongue or sa middle burner area. The clinical significance of the stomach crack is either a stomach yin deficiency or a constitutional tendency to stomach patterns. The stomach crack differs from the heart crack in two respects. So, tandaan po natin ito, yung pagkakaiba ng stomach crack sa heart. Number one, it is only in the center. So, ito po yung picture. Tingnan natin mabuti na ang stomach crack ay nasa may center. And secondly, it is wider than the heart crack. So, mas wide po yung pagka-crack pag sinabi natin stomach crack. So, here we use points, REN 12, stomach 36, spleen 6, or even just REN 12. Kung nakapag-observe po tayo nitong mga stomach crack. Okay? Next, another example of a stomach crack. Nasa may center and wider po yung crack. Okay? Makikita po natin itong mga pictures. Next is scattered stomach cracks. May be all over the tongue. They are either small horizontal cracks or irregular cracks that in Chinese books are described as being the shape of the Ren character. The clinical significance of the scattered stomach crack is either a stomach yin deficiency or a constitutional tendency to stomach patterns. So, here yung mga scattered stomach cracks. Ang picture, i-observe natin mabuti. So, yan po, mga different pictures. The lung crack is a central crack in the front third of the tongue. It indicates a constitutional tendency to lung patterns and lung yin deficiency. So pag naka-observe po tayo nito sa may lung area, it's either lung yin deficiency or a constitutional tendency to lung pattern. And we use points lung 9 and REN 12 for the treatment. Okay. Okay, here another example of a picture of a lung crack. Nasa may lung area po itong presence ng crack. Okay. Next is diagonal lung cracks. Indicates a past lung disease such as whooping cough in childhood. So kung observe po natin yung picture, meron siyang 2 diagonal cracks on the lung area. So sa lung crack, itong po ang mga picture ng 2 diagonal lines. Very visible po siya. Okay? Lung stomach crack. A lung stomach crack is a combined stomach crack that is in the middle section of the tongue. So isa lang po siya na nasa may middle. And the lung crack because it extends to the lung area front third of the tongue. So combination ng stomach and lung crack. Dito is another examples of pictures of lung and stomach crack. So combination po siya. Observe po natin mabuti. Okay. Next is the spleen cracks. Spleen cracks are small transverse cracks on the edge of the tongue. So sa may gilid, they indicate spleen yin deficiency. Okay, observe po natin mabuti. Very visible po siya. Next, ito pa rin, spleen cracks sa may sides. Okay. Next is an old age cracks. Also called an ice-floe cracks. They are not common and they simply indicate kidney deficiency from old age. So usually nakikita po siya sa matatanda, indicating there is a kidney deficiency. So old age crack, ito po yun. Okay. Next is a kidney crack. Is longer than the heart crack, extending towards the root. So papunta po sa likod ng tongue. It is also deep and it has small cracks radiating outward. So yung maliliit na cracks nag-radiate sidewards from the center. It indicates a severe kidney deficiency, usually yin, and due from overwork. Okay? So ito po yung kidney crack. Galing sa may center hanggang doon po sa may likod and meron siyang maliliit na papunta sa sides. So thank you po for your attention.